Hi, I'm Dr. Kathy Swain Jones.
Hi, I'm Dr. Denise Joseph Zollicoffer.
Hi, and I'm Sonia Williams Finney.
And this is
Menopause Diaries, real talk, real stories.
Welcome, everyone. We're so glad that you're joining us today for Menopause Diaries, Real Talk, Real Stories. This is another wonderful episode as we navigate this life and this menopausal journey. We are so glad that you have joined us. If this is your first time, welcome. You are going to love it. Take it from me. You're going to love it. You're going to want to tell all your friends and neighbors, your enemies, doesn't matter. You're going to love this and you're going to want to spread it, and we want you to do so. If you are a recurrent listener, we are so glad that you have joined us. And, here again, tell everyone about this, because we're getting down to the nitty-gritty of things that affect us and how we deal with them, and getting the word out so that we can all live longer, healthier lives. As Dr. Kathy liked to say, this is the beginning of the wonderful journey and a healthier life. And today we have a wonderful guest, and I'm very thankful to her for choosing to tell her story to us and with us today. I'm joined by Darlene Valson. Welcome, Darlene.
Hello everyone.
Hi.
Thank you so much
for
welcome. Agreeing to come on the program and
my
sharing
pleasure.
your story.
It's my pleasure.
So without much further ado, I want you, Darlene, to just tell us your menopause journey. We're just chatting. We just want to have a good time sharing your story and educating people. And, you never know whose life you're going to touch with this one.
Now, let me interrupt first. Darlene,
Yes.
this is premenopause story, right? Are you, you guys can't see her, but we are looking at her here in the studio. And I just want to confirm you are menopausal.
Menopausal.
Okay.
Definitely premenopausal. I wish. Menopausal.
Wow.
But you know what, Dr. Kathy, we don't crack. We
There
look
you
pretty
go.
good.
That's true.
There you go. Well, I wish everybody could see her. Absolutely beautiful. And this is, again, this is what Menopause 2024 looks like. And so for all of you who cannot see, a lot of the things that we try to bring together here and with these stories is to learn from what we didn't learn that we can teach each other. So go ahead, Darlene. Thank you so much.
Right. So my my menopausal story, it was crazy. I was around in my 40s, around 47, 48, and I started having palpitations. And I thought, oh my God, is it anxiety? I'm really stressed. Went ahead and did an EKG, did the whole cardiac workup. And then it started with mood swings. I would sit in the car and cry, and I'm like, what am I crying for? There's nothing going on, and I'm crying and aggravated all the time. And then months later, I started, okay, I'm going to go ahead and research some of these symptoms. And then, of course, it was the irregular periods and so forth. And that was the premenopausal stage. And then, of course, then it went to the menopause, and then the hot flashes and the low libido. I'm like, my poor husband, I have no desire. I'm like, I don't even want this man to touch me at this point. Besides
Give us a timeline of kind of when everything started for you. So your premenopausal started about what age?
Around 47, 40, I would say 47, 48.
Okay.
Premenopausal, yeah.
And then that's your irregular cycles then also?
Yeah.
Okay, and then when you considered yourself menopausal, how old were you then?
So menopausal, I was 49 at that point. That's when I didn't have 49.
And is that when you kind of was that the something is not right here?
Yes.
Okay.
Yes, definitely. And then the weight gain, I would tell my sister I would smell a piece of chicken and I would gain 10 pounds. Why am I so big? And I can't lose the weight. She would say, okay, you can go and exercise for 10 years. You will lose 1 pound. I'm like,
how did you feel though? What is that feeling of did you feel ashamed at 49? Because I went through a little early. So 46, 47. And it was, for me, it was something I wanted to hide. like I'd rather be thought of as something else going on with me than, to say, oh, I think this might be menopause. I couldn't even say the word. How did you feel around that time?
I didn't feel ashamed. I just didn't have any idea what to expect because, of course, my mom died at an early age, but I did have my aunts around. I did have older cousins around, and nobody talked about it. So my thoughts was, what is going to happen to me through this process? I'm thinking, first of all, I'm thinking, okay, am I going to start, my skin is going to be dry. Am I, you know, um, my sexual desires, they're gone. And I'm thinking more the future. And then I'm thinking, oh my God, I'm getting old.
Could you talk to your husband about it?
For me.
Were you able to talk to your husband at all about it?
Okay, of course, my husband, he's from the islands, and I've tried to talk to him about it, but for some reason, I don't think he's piecing it together. He's not piecing it together as far as my emotions, as far as, low sexual drive, my weight gain, my attitude sometimes. He would just say, oh, you're starting up again. That's his favorite stage. You're starting up again. There you go again.
That's what I wanted to say, though. And that's what I think where a lot of women get stuck, because it's almost like you're damned if you do, you're damned if you don't.
Yes.
If you talk about it, because, men are visual, men are like to think they're always in the, spontaneous.
Right.
And when you start talking about the difficulties of how we saw our grandmothers and all of that, you don't want him to see you like that, saying that word.
Yes.
And so I think a lot of women do get, so I was just kind of wondering how you made that through. Because for me, I just denied it. I would sit there sweating and needing to take my clothes off and just act like, okay, like I just couldn't, I just, and at 46, that's just not something you want to start talking about. I think I'm menopausal, or I'm going through menopause. And that was years ago. So, but so how did you guys finally, find a common ground, or it was because that's a hard place to be in, being accused of being, difficult, or there you in your mood again, and like I want to help women kind of navigate that conversation.
Mm-hmm. Okay, so now we definitely found a common ground, because I remember recently we traveled. We went to Massachusetts, and of course the weather there is freezing cold, and so he did mention, and so the heater, we had to put the heater on, and he did mention, oh, okay, oh, I know I can't put it on too high because of your sweats at night, your night sweats.
Yeah.
So I says, okay, he's getting it.
Yeah.
And that's crucial.
Yeah. And then sometimes the fan on at night, and then he'll put the fan on low, and then he remember, and he says, oh, okay, no, I'll leave it on high for you, because I know you in your night sweats at night. So he's getting along gradually, but I don't think he comprehends the whole concept of it. But he is getting along.
Yeah. And I used to tell women it's hard, especially years ago, when we didn't know how to rationalize it. So then how can you, help your partner understand? But that's a really crucial area for a lot of women. And I think a lot of them come in kind of devastated and in tears and looking for help because of that breakdown right there. That's, yes, it's the hot flashes, but it's also watching your intimacy change, and you don't know how to explain it, and saying, well, I want to,
right.
that doesn't work. That's where probably hormone therapy, for some women, did you ever try that or think about that at all?
I've thought about it. I think, I definitely think, maybe before the end of the year, my husband and I, we really have to talk about it, like deep conversations, because, I don't want to lose that intimacy with him. And I don't want him to feel neglected, I would say, because I try, but it's just not there. And some men would say, oh, okay, you just don't desire me anymore.
That's what they always say.
Yeah.
That's the first place they go.
Yeah.
And then you're
like, do you really want me? Do you really love me anymore? Do you really want me? Those are the questions sometimes that comes up. And of course you can sit and try to talk about it, and I don't see him realizing really what's going on with me, with my body.
Yeah. And I think just only because they operate differently. I don't really think, from doing this for 30 years and working with women, I don't think they really, they don't separate, they don't understand menopause and understand that it's not a conscious choice to back away. I don't know how to help myself right now to feel what I want to feel. And then you go to the doctor and they're not so helpful. But there are things, there's some things that you could even consider doing now, like some maca, is very helpful for sex drive, even B complex to help kind of settle that little anxiety that we start getting about not being able to. So if you looked at doing maybe some natural things, and we'll have, I think, it's a real good opportunity to have a conversation about, some of the natural things that women can do for that. But that you might want to look at, because you have options. So that's what I want to leave you with. You have options of plant-based bioidentical hormones that you can use topically. You can use vaginally. They do not, the topical creams and patches are not metabolized by your liver, so that for most women they're safe, and your doctor will help you determine that. For the vaginal dryness and for the clitoral stimulation, there's vaginal, plant-based vaginal creams that are made from yams. And then there's non-hormonal supplements that can be used. And I guess what I want the takeaway to be is there's something I can do about it. And we always say, first go to that gynecologist that and say, hey, no, this we need to address. Because I always say, had I had options years ago, I might have stayed married. And I say that honestly to the younger ones, because that's the reality of what it is. Their brains think differently. They feel rejected.
Yes.
And then if we don't know how to explain menopause, and we don't know, we should be aggressively seeking options to save our relationships, because it will be a breakdown. They just can't comprehend it.
I agree with you.
Darlene, I'm wondering, for our listeners, I wanted to get a little bit more information from you about what conversations have you had with your husband, because some people, a lot of people are dealing with the same issue, and how do they navigate that within a relationship? Like Kathy said, had she had more information, maybe she would have stayed married. So tell me a little bit about the conversations you have had, even though you may not think they've worked, but tell me about them.
So the first conversation was, okay, no more periods. First thing he I says, I'm going through menopause. First thing he says, oh, so that means no more periods. So I'm feeling this is what the first thing comes to his mind. Oh, okay, she's not going to have any more periods.
And actually, he probably thought that was a great thing.
Yeah, he didn't know what else comes with that.
Wait, my husband, he's just I'm not even going to say special, but he's one of a kind.
Because that's a beautiful answer, because that's actually an untainted mind. Because a lot of men who have experienced grandmothers going through menopause would have said, oh, wait a minute. It would have been like kind of a negative thing on, oh, that means your vagina is going to get dry. You're not going to want to have sex. You're not going to. And this may be the perfect opportunity to start helping formulate conversations to make it a positive. No more periods, but then also know that we have options with the hormone replacement, with the natural things, or with even balancing yourself from a functional medicine standpoint and rebalance the hormones that you do have. So there's actually 3 options. And so to then the next thing out of our mouths with that conversation can, can be something positive. So that's wonderful.
Right.
Where did you guys go after that?
And then it was my weight gain, and and I said, I said, I feel that's one of the reasons why I can't lose weight, and he kind of just looked at me like, oh, yeah, really, like, really, And then we talked about, my low sex drive. I don't think he comprehend the sex drive thing. I don't think he comprehend that. I did try to explain
difficulty before you had that conversation, or did you just volunteer it? Was there kind of like a little difficulty time where
it was I must admit it was a period of a few months where it was really rough for us. Because we've been together 20 plus years, and this was, I would say, a big thing, the sexual desire part, because we never had that problem. Then all of a sudden, hey, I come, he has the desires and I don't. That's big, And then the rejection part, of course he feels rejected, and day after day he feels rejected, and then it's going to be a point where, I'm a woman. I would say, okay, I'm just gonna do it just for the hell of it.
Well, who did you use as your support group? Like, who did you talk to? Did you have family and friends?
I spoke to my older sister, and she went through the same thing, but with her, she had a hysterectomy in her early 40s. So she was explaining it to me. She had the same thing happen to her too. And I really don't want to say it, but a lot of women. I spoke to another friend of mine, and she says, "Oh, just fake it," But I'm like, that's how healthy is that?
Well, and that's the thing.
And then you get in your own head.
Edit that out.
Yeah.
No.
But you also start to get in your own head. I mean, I'm not in a relationship right now, but I know what you're saying, and I know that as much as your husband didn't understand, it's not an easy conversation to have with, with your partner. And I know that for me, I mean, just you start to feel lesser than, it starts to work on your own psyche. So first you've got to, get well and make sure that you're good in yourself. And for me, I felt like I was losing like a part of my confidence and self-esteem. It starts to really wear on you. So then you've got to deal with you before you can even go and have those, tough conversations with your husband or partner. And, but as Dr. Kathy was saying, I mean, I definitely think she kind of brought up the maca. And I can tell you that, I mean, I have tried it, and it makes a huge, huge difference. Okay. I'm not in a relationship now, but I can tell you that it does kind of stimulate things that, you'll be like, I mean, I like might walk down the street and, you see somebody and you'll be like, oh, okay. But for me, because like I said, I'm not in a relationship, but I do feel that there's something being stimulated there now, so that if I get to the point where I'm in a relationship, I know that, hey, that desire might be there. Because when I tell you I did not even think about it for years. I mean, years.
And you were okay with that. And, you kind of get like it's like everything else is working out, just that you just don't feel.
Yeah, you feel nothing. I mean, for me, I felt nothing, zero, nothing.
And with the maca, she was even saying she had kind of turned it down a little bit, like
I did,
instead of a whole scoop, a half a scoop, because you want just enough to know I'm still a woman. He looks good, but not enough to, so that's something you might want to consider. But here's, before we move on with this, it is important that women understand there's actually, we came up with 3 of them: the plant-based bioidentical hormones, the natural substances like maca, rhodiola, there's other ashwagandha and functional medicine rebalancing. So there's options that you can sit and come up with a solution. And that's really probably what, you need to, kind of look at one of those lanes to address it, because there are either hormonal or non-hormonal.
I
You
agree.
can bring that back.
I agree. And, definitely that's our plan, because we did, we spent some time together. Like I said, we took a trip, and I feel that helps too, just to get away. We, do little getaway trips, just to boost up the relationships, and I feel that worked really well. Like a
But
different
you need
setting.
some premium gas in the car also.
Yes.
And how can he walk around with a young lady looking 25 and the engine, the gas is, you're using regular gas.
Right.
I mean, really, I think for you, and this is really what this is about, is encouraging you. The stuff works.
Yes.
We just, again, part of it is you come from, tell us more about, like, in Haiti, were there herbs that people used? Was there hormone replacement that they used, like your mother, your grandmothers?
Right, but I think it's more herbs that they used. But what I don't like about my upbringing, we never spoke about this. We never spoke about menopause. We never spoke about periods. I remember the first time I had my period, I was afraid to tell my mother, because I thought it was something I did. And I feel like menopause, I think that we look at it like it's the end of our womanhood, basically, because it's not a spoken thing.
Yeah.
Because even with my sister-in-law, she was having hot flashes, and she came to the house, and I told her, I says, "Are you going through perimenopause?" Because she was in her early 40s. And she looked at me like I asked her, to kill her husband. She gave me a look like, "Are you crazy?" She said, "No, I'm not going through perimenopause," because we just don't talk about it.
Yeah.
And I just want to say, you're from Haiti, so you have a Haitian cultural background, and so and I just want to clarify that, because we started talking, and I want to make sure that everyone understands that.
Yes, I am from Haiti. Like I said before, this is something we don't talk about. Yeah, we don't.
Well,
talk
I think
about
even
that.
and everybody here in this group of us ladies today also came from environments where our grandmothers and our mothers really didn't talk about. My mother didn't talk to me about
And
menopause.
mine certainly
I know
didn't.
she went through it.
Yes.
Mine never did either. Even like you said, even about
my
a
grandmother
period.
certainly didn't. You could tell by the certain things they gave up in their life.
Yes.
To tell by they were more brother, sister, best friends versus, still loving relationships
Yes.
and all of that. But the intimacy that we knew at 30 and 40, you didn't see that. And so, but the exciting part is that, with just getting, and this story is powerful because women need to, this is the hardest thing for them to even talk to their doctor about. And then they might say something and the doctor's kind of shy about it and will say a little bit, but they won't have this level of conversation that it's real. It affects relationships, but there is help. And if you don't force that conversation, you'll never know that those feelings kind of feel good even without a relationship, don't they?
That's true.
They
Yes,
feel
they do.
amazing,
It's like a
especially if you
warm
haven't
hug on
had
the
the I'm
inside.
telling you, you guys, I'm talking like probably a 10-year span of feeling nothing. And then you start to think it'll never happen again. So when it does happen, it's like, oh my gosh. So I'm just kind of like excited and waiting for whenever that person comes. I know that there's hope. Yeah, and I'll be ready. Yeah. Yeah.
Yeah, you will be. And actually, you look about 10 years younger too. You do.
Thank you.
So Darlene, talk a little bit more about how culture impacts your take on menopause and the people that you're in contact with, how it impacts them.
It impacts because we I'm kind of hesitant to even share it sometimes
Mhm.
with family members what I'm going through. Like my sisters, yes, we do talk about this, and we would sit and talk about how we know that our older family members went through the same thing. They didn't share this information with us, and we would sit, my two other sisters, and we would talk about this. But the thing I want to change is my two daughters. I don't want to go through that with them. I want to expose them to this. I want them to see my journey. I want them to see what I'm going through. I want them to ask questions. And in our community, we are afraid to ask questions about menopause, about our health. And then we don't want a stigma, okay, she's going through menopause. With in my community, menopause, I feel, is like the end of the road for a woman. This is the end of her. She no more sex. And you can see it too. Sometimes you go to church with and you'll see like two older couples. You don't see that closeness with them. The wife is here and then the husband is here. There's no intimacy. And in our culture, we don't talk about intimacy. We don't talk about sex. We don't talk about these things. And then for menopause, I feel there's a lot that can be shared, but we just do not ask any questions. That's the way we were brought up.
Yeah.
And that's why we started this podcast too,
exactly.
is because we want to make sure that women don't feel that way and that they feel like they can talk about it, and they should be, they should be comfortable talking about it. So that's definitely why we said, we need to do this so that women, that the generations coming up, for them, it'll be like second nature. I mean, it'll be, they won't have to go through what we are going through.
Exactly.
They feel like they're the only one, and that's how you kind of feel. Get in that little space of, I'm the only one going through this. Everybody else is faking it just as much as you are, making it seem like everything is fine and not talking about it, but it really isn't. And they can be in a long-term relationship, but nothing is really going on. And it's not really good. It's something that really should be addressed. And again, you can do it. In the days ago, it was all the synthetic hormones. So a lot of women backed away. Well, if that's what it has to be, I don't want to do that. And hey, just take me the way I am. I'm not going to risk my health. And now it's not like that. There's so many healthy options to keep that going.
But
we're going to have you back when we have you revved up to tell the
yes, I can't wait.
If it's trust me, you will. I'm telling you. I'm telling you. Poster child, it works.
But how would someone know? For example, Dr. Kathy, how would for example someone going through menopause, would they ask their GYN about non I would say
non-hormonal
based, right?
Yeah, that's tough because there's certain things that we're taught in medical school and there's certain things that we're not. Medical school, we are very well versed on prescriptions and medications, disease processes. Menopause has been one that unless you go do all of the work yourself to figure out what's the best thing for my patients, a lot of doctors don't really even know basic menopause. So one of the things is there's the Menopause Society that has certified doctors who can discuss from an educated level on hormone replacement and all of those options. There are holistic and functional medicine doctors who can tell you more of the rebalancing your own hormones or using the non-hormonal options. That's kind of what I do. Is I do the functional medicine side. I'm a gynecologist, but I chose to do more of the functional medicine rebalancing side of it and the natural hormone side of it. So I would start with your gynecologist and see. And here's the thing. Here's how the litmus test. You ask a question and you get an answer that makes sense, that moves you forward. If you get an answer that's normal, that's not the right person. They don't have the knowledge to help you. And so, you can just find that person, anybody who has hormone expert after their name, whether it's a nurse practitioner or, any type of provider who has said, you know what, I know all of the current things to help you with whatever hormonal issue you have. That's a person that can help somebody who wants to choose that natural route.
Well, I have to jump in though, Dr. Kathy, and say that coming as a person who went through like 3 different gynecologists in 1 year, that even though the person has that, because I was reading an article and there's like a list of people that are quote unquote certified. So what's the group that certifies people that are in menopause?
Yeah, North American Menopause Society. They're called Menopause Society now.
Yes.
American.
So I actually chose 2 doctors that were on that list. And if I'm being completely honest, I still didn't feel like I got the answers that I needed. So I think that you as an individual need to say, is this person listening to me? Do I feel heard? And, are they taking into consideration all of the symptoms and things that I'm telling them that I'm having and not dismissing it? Like to your point, they shouldn't say that that's normal, but I think everybody's journey is different. For me, I know that I have easily 10 to 15 of the symptoms of menopause, but I finally found someone that heard me, that heard, the issues that I was going through and that was willing to address them. So I think that, you again, as an individual and to our listeners, and you have to decide, am I being heard? That's the big thing for me. Do I feel like this person is listening to me and hearing me and willing to, I think we have to do our own homework too before we go into our appointments and say to the doctor, these are all the symptoms that I'm having, and make sure that, they're giving you something. If you don't want hormone replacement, like Dr. Kathy said, there's other options. You don't have to take hormone replacement therapy if for whatever reason you can't, but there are so many different options there. So you just have to make sure, for me, the biggest thing is that you're being heard when you go to your doctor. And then I want to ask you a question. So throughout this process, have you had a conversation with your gynecologist, or has that person ever suggested hormone replacement, or what's your conversation been like with your own gynecologist that you have right now?
So it was a conversation. She did offer hormone replacement. I was a little hesitant with hormone replacement because my sister have a history of breast cancer, so I pulled back. But I know there's a lot of research that's been done with the hormone replacement, but myself, I didn't want to take that. And then she also offered Paxil, low dose Paxil. And then of course I was a little hesitant about that too because of the weight gain. I looked at the side effects and I don't want to Paxil because of the weight gain. I tried black cohosh. Black cohosh worked for a while, and then it stopped working. There was another product I got on Amazon. I think it's called Menopause Ease. That worked for a while also, and then it stopped. And so what I've been doing is I've been looking at foods that really aggravate my symptoms. For example, I know like caffeine. If I drink caffeine, I'm gonna break up enough sweat. Red wine does it for me. Spicy food does it. Any kind of alcohol I drink. So I'm very cautious about that, the foods I eat, because I remember like yesterday I had some spicy food, and we cook with a lot of spice, and I put a little pickles on there, and there I go, drenched.
I can totally relate though too, because honestly, one of the gynecologists that I saw during that period where I saw 3 in 1 year, like you, she recommended Paxil for me. And for me, I had other concerns about it because I'm always kind of funny. I don't like medicine to begin with. And then for me, I knew that that was something that was prescribed for people that, have some type of, as I believe like antidepressant kind of symptoms. So
Yes.
for me, I didn't want to take it for that reason, but then I did try it and I got the worst headaches for like 2 or 3 days. So I quit it. Like, right. I'm like, no, I'm not taking that. So I completely understand what you're saying about being a little hesitant and reluctant. Same thing with the hormone replacement. I was initially concerned, but then after, hearing about, how the negative stigma that came with it from like studies that were done like years ago and getting more information, I felt a little more comfortable. So I do take the hormone replacement. I do just like a cream. It's a bioidentical thing that's, compounded at a pharmacy for me. I put a little on my wrist at night, before I go to bed. And it's worked for me. It's a topical thing. But again, but I also do some other things too, but I completely get like being nervous and, not being comfortable taking some of the other medications or things that are presented to you. But I also think that the physician should, again, listen to you and say, this is not something that, I want to do. With the Paxil situation, she was like, oh, you just need to keep taking it. And I'm like, no, I'm having headaches. I don't want to keep taking it. So again, back to just make sure that you're being heard. I think it's so important.
And I would say that most of the clients who come to see me are in that same experience. They go into their gynecologist they've been going into for years, and to have these conversations and past the first question, there really aren't a lot of answers. It's either kind of, this is what I usually give, and either you take it or you can take it or you're not, or you could take this, but there's an answer really for everybody.
They're just not given the options.
They just, yeah. And it's just because they're not, it's not a sort of a mainstay for a lot of patients. Most patients who come to me have tried other things and they're looking for something different. And what most patients don't understand is that we have 3 grades of hormones, a weak, a medium, and a strong. And what happens during menopause is there's reactions that happen that cause us to divert how we metabolize our estrogen. And so some of your symptoms could be coming because you're not metabolizing around the right pathways, or you're absorbing some of the toxic forms of the estrogen that should come out. And so from a functional medicine standpoint, there are a lot of women who present and don't want to use the hormones, and they choose that as an option to rebalance from the inside, from the testing that we do, targeted testing that's able to rebalance you without having to use hormone, period. This should be mainstay in clinical medicine, and it's not. Your doctor should be giving you those options, and it's not. And so the whole study of functional medicine is doctors who have basically done both sides, and there's other providers who do it, but when you've done evidence-based, which is hormone therapy, and how do you balance the body for it works for everybody. You just have to do the testing that's not available in the doctor's office and do the rebalancing, and that is a viable option for somebody who says, I want anti-aging, I want longevity, I want heart health, I want brain health. All of those things come with a functional medicine sort of balancing. And so I say that to say there's options at every stop of the way. And if the first stop you make is not the right person, then you look for, again, somebody who has that expertise. But like Sonia said, you could have that expertise, but still not have a lot of options to give. And you look for the words, functional medicine, holistic, hormone balance, that kind of thing.
Darlene, had you ever heard this information before?
I've never, and I was just going to say this. I'm so happy for a podcast like this. I've never heard this information before. And like I said before, when I went to my GYN, she did not give me these options. She gave me the 2 options, was the estradiol and the Paxil. I wish I did hear this information before, and and I'm happy that other women will be hearing this information too.
Yeah.
I know they'll be excited about this information. Because
because at our age, we actually, this is to me the most fun part of having all of the knowledge at our age. But then if you can couple that with bringing the energy you back that you had when you were 20, that's a powerful woman.
Yes.
And to accept and that's why I kind of left conventional medicine to go into my own practice. But the reason is because to watch women hit that roadblock at menopause, and you only give me 10 minutes to try to give them answers on how to regain and move on. And if they don't get those answers, what do? We just keep rolling backwards. We lose our relationships. We start having dysfunction at work. We start feeling isolated. We don't know what's going on, and none of the answers come. And it's either you do this or you do that, and then you start getting other things. And so there are definitely answers, and there's answers for you to turn that around as well.
I'm excited about this. I'm happy I came on this because I'm looking at the marker. I'm excited about the marker.
And I know that there's different different methods. It comes different ways. But so the one that I have, it says the recommended dose is like 4 pills. So I'm telling you that, I mean, I took like the 2 pills and honestly, I was like, oh, okay. I didn't even go to the 4 because I was like, I can only imagine what would happen if I took 4 of these things. So I do honestly, so I do like a maintenance. I just do 1 a day now. Like I said, I'm not like in a relationship, but I know when I need to dial it up, I'm like, okay, I'm ready,
And men can take maca also.
Yeah, I saw that. I read that. Yeah.
And the thing is, when we take something like that, we're not necessarily, we are taking it for him, but we're also taking it for ourselves. We forget about us. Is that even if you're not sexually active, to still feel like a woman who has all of
vibrancy and
all the vibrancy makes you still functional when you're in the boardroom, when you're in a meeting, when you're talking to people. You still feel like that boss lady that you are, versus having all of these things that are crumbling on the inside. And that's how our mothers felt and our grandmothers felt. Like, let me just be mama, because what other value do I have other than taking care of the grandkids and making sure Sunday dinner was cooked and all of those things that they did to show us love. We need vibrancy and want to maintain that.
I agree. And like said,
for me, I say when you feel good, you look good. I mean, there's something about just feeling good on the inside. It just kind of radiates. I mean, it just shows. Like, so there's, for me, like I said, I use the word like, I like to refer to it as like my self-esteem, because my self-esteem had like just was at an all-time low, seriously. Because I mean, for me, you didn't mention some of the other symptoms, but for me, it was the brain fog. It was the lack of energy. It was the vaginal dryness. It was the lack of sexual. It was, I had everything, but I didn't even know. That's the crazy thing. I was suffering all of this stuff and did not even know. And by the time I finally got to somebody to help me, they were like, I don't even know how you're functioning. Your estrogen levels are so depleted. So for me, that was why I also decided to go the hormone replacement route. But like, there's so many other things that are out there as well that I've, supplemented with as well to make me feel like, or start to feel like myself again.
Did you start feeling, Sonia, less powerful in your daily interactions?
Oh my gosh.
Because I mean, like at a meeting when you're like, what you want to say, but you can't think of what you want to say.
Out. Yeah. And and I start like, this is not me. I'm usually, I'm like, who am I? You don't even recognize yourself anymore. Yeah.
Right.
And you start getting mad when you feel like the conventional system is letting this happen. And God bless, the Menopause Society for helping and training so these doctors can have conversations about menopause. But we also need to be going deeper and knowing that there is a deeper balance that will take you all the way. That we could be
Mhm.
sitting here at 80 having the same conversation, looking the same way. That's what I'm claiming. And looking the same way and talking about, all of the exciting things that we're doing because we've learned how to do the inside and the outside.
Absolutely.
So,
Yeah.
so these, Dr. Kathy, these supplements also work for moods. For example, like sometimes the depressed mood, you kind of like don't want to get up, you don't want to get out of bed, like the
Yeah.
fatigue.
Yeah.
So they'll also work for those symptoms.
Yeah, it works for that. And there's so for the mood, I usually recommend a supplement called rhodiola rosea. And
I
that
take
helps
that one
balance.
too. Poster
Yes.
child.
That's right. That's right. I have it helps balance the serotonin and dopamine. But what I would say, and I'm not calling no names, but what I would say is if we balance the inside, you talk about, I would claim so our serotonin and dopamine balance, the brain fog, the insulin resistance, depression, the anxiety, all comes from an unbalanced gut. And a lot of times when patients come in and they're struggling with all this, because here's the way you have to look at it. If you're taking maca, or if you're taking rhodiola, or if you're taking something for all of these things, you're going to have to keep taking it because you really didn't fix the imbalance on the inside. And so there are patients who come in and say, I've done this and I'm doing great, but I got to stick to these strict foods, this particular regimen. I can't miss this. And then they're seeking more like, I want to take the chore out of being healthy. And that's where the balancing comes in. So where we do testing to just see what's off in the microbiome, get rid of the things that are overgrown, grow the things that are undergrown, and then you begin to metabolize your own hormones naturally. Your insulin resistance goes away naturally. Your gut brain axis clears up and balances. So your brain fog goes away naturally. You don't have to, there's no getting off because you fix the source of the problem. So all of your supplements can help, but then there comes a time when women feel like, but I don't want to be chained to, $200 of supplements every month. Yeah. So what I'm saying to you is for you, the ashwagandha, the rhodiola for the anxiety, because rhodiola balances your serotonin and dopamine, but your gut microbiome controls the balance of your serotonin and dopamine. Does that make sense? So you can take a herb to balance it, but if you balance the source of why it's imbalanced, then you don't need the rhodiola.
Okay.
Does that make sense?
That makes sense.
So functional medicine treats the root of the problem. So there's a way to do that, and then there's a way there's supplements that help you feel better. So for you, the maca and the rhodiola is a good combination. Brain fog a lot of times is from insulin resistance. So then you got to kind of find out, what's the best way to treat that.
Okay.
I don't want us to leave without you sharing a little bit of what you had told me about the Haitian culture. I know I'm talking about culture a lot because I think it's important that we address it, and how people you have talked to within the culture talked about voodoo. Explain a little bit about that for us.
For example, like the symptoms, I was talking to you about that. A cousin of mine told me, she has symptoms of, the palpitations in the night sweats. And then sometimes there's a feeling like she said that the heat is just coming from under her skin and coming out. And she says that she felt that it was voodoo, if somebody was just trying to do voodoo on her. And then I was trying to explain to her, no, you're in your 50s. These are menopausal symptoms. And she flat out told me no. She says, no, it was not. She said it was witchcraft. Someone was doing witchcraft, voodoo on her.
How old was she?
She was 51.
Yeah. But you know what? Deep down, I'm wondering if she had some of the same misconceptions that we had, because when the symptoms hit me, I would rather people have thought that I had some kind of debilitating illness than to even mention the word menopause.
Yes. Yeah.
And I would not mention the word menopause. I would just make excuses on why I was moody that day. Well, I work as, never would I have, and I kind of knew this probably is menopause, but
Mhm.
I couldn't mention it. And so maybe she's saying that's pretty sad. That is
Yeah. And she
voodoo is
argued
better
and
than
argued,
menopause.
she argued with me. It says,
Yeah.
no, it's witchcraft, it's voodoo.
But let's think
Argued
about
with.
why. Because what makes us women is that one little thing that's different that makes them men. And we
Yes.
love that about being a woman,
Yes.
feeling like a woman. When you lose that and then also feel like you will no longer be appealing to the man,
Mhm.
it's devastating.
It is. It's devastating.
That's why I would encourage any woman who is there is to just seek help, seek help, seek help until you find help. Especially with these conversations, women are going to feel more empowered that no, if you can't help me, I know somebody out there who can.
Yes.
You know what I mean? And they'll find those people.
I agree. Yeah.
So, Darlene, I am so glad that you came up today because, we are all women of color and we come from different cultural background. And when you told me that story about the idea of voodoo and witchcraft, it really broke my heart in the sense that I feel like we're just not educating each other. So you being willing to come on and so candidly share your story, I think we can make the impact upon the Haitian culture, the African culture, any other, all the cultural stuff that we have that we don't understand what's happening with our bodies and dispelling some of those myths. So I'm really glad you did this for us.
Well, thank you. Thank you for having me on this podcast. I myself learned a lot. But within my culture, I just wish that we would open up more, the women. Forget about our grandparents, forget about, our ancestors, open up more about the feelings of what you're going through, especially the intimacy. Nobody talks about that. No one talks about that. No one talks about, hey, my libido is low, no one says anything.
And I think it's just because when you go to get help and you're not offered any help, it's almost like you'd rather just keep it to yourself, because a lot of women, believe it or not, are told that's just part of getting older, and they're left with that.
Right, but then your relationship suffers.
Yeah,
your relationship suffers.
Yeah.
Your mate suffers, and the whole dynamic changes.
Yeah.
Well, one thing that our listeners can get out of this story is that I think that you now are a believer that you can conquer this. You can get your vitality,
and I'm so excited about that. My husband will be so excited about this.
Yes.
Don't tell him.
I'm not going to say anything. I'm not going to say anything.
Surprise
him. Say anything. I'm going to surprise him, and he's going to say, "Wait a minute, where's my?"
And if there's dryness, you may want to go to your gynecologist and just ask about the plant-based topical hormone cream for the vagina. It does not enter into your system. Even breast cancer survivors, once they've gone past, because it's like zero detection, they're able to use that. But that also then would rejuvenate the vulva, the clitoris, and the moisture glands and the moisture inside the vagina. And so then, because maca will get all of this going, but it may or may not, depending on where you are, give you complete rejuvenation of the vagina. And you want that part too, because you want to have all of the blood supply and the engorgement to the clitoris to bring all of those feelings back as well. So the combination of that maca, and I would go, your gynecologist should be able to help you with the plant-based hormone vaginal therapy.
Okay. I know I sound like a broken record, but I take that too.
We're all coming to this wedding in 2025 because she is ready.
She's ready.
Oh my goodness, my baby.
Oh yes.
I'm getting ready.
Yes, you are. I'm telling you.
Darlene, before you leave, one of the things you shared with me was how you're taking your mess and making it your message. I know that you're a nurse practitioner, and that you have started your own practice because of your struggle with your weight. You've started a weight loss practice. Take a few minutes, tell us about that, give us information, because I want, you're French speaking, you're Creole speaking, so I want, any people who need to speak to someone in their native language, how can they reach out to you? And then for us who speak English, you obviously speak really good English, so we could come to you also. So tell us a little bit about your practice.
Okay, so a little bit about my practice. We center on weight loss. Something special about my practice is I work also with a wellness coach, and I feel that was the piece that works perfectly for the patients, because you have a wellness coach which holds you accountable. You get to check in with a wellness coach twice a month. There's a plan, a meal plan, exercise plan, and then we do offer weight loss supplements here also. So you get a weigh in. I'm also a medical provider, so I do the whole assessments because not everyone can take a certain supplement. So each supplement is personally geared towards the patients. We do encourage exercise. Exercise is big for us. We definitely encourage exercise 3 to 4, at least 3 to 5 days a week, and have them implement exercise too. We work with a gym in this area. And we also have them, if they can, get gym memberships. Also,
do you do injectables? Talk to me about what kind of what do you prescribe?
So we do the GLP-1s,
Gotcha.
The Mounjaro and the semaglutide. And we are going to be offering also IV hydration. We have a combination of IV hydration. One is for brain fog that I feel it really works for the premenopausal and menopausal patients. And the other one is for, just for extra energy.
Okay.
What
is the name of your practice and how can we reach you?
Name of my practice is Homebound Medical. You can reach me at 754-755-6610.
All right,
755-755-6610.
And where are you located?
See you, or do they have to come actually to your physical location, or do you do online consultation?
We do online. We do telemedicine and we do virtual also.
Okay. Do you have a website that they can go to, or?
Yes, www.homeboundpmp.com.
Okay.
Homebound
PMP.
Okay. Okay. Very good. And where are you located if people want to come to your physical office?
So we're located on 317 South State Road 7, Plantation, Florida, 33317.
All right. Well, this brings us to the end of our program. But here again, I want to say thank you. You've been very, very candid. I hope you've got really good takeaways from this.
Oh, yes, definitely. Definitely the marker, son of Penny. I am going to do the triple marker.
Yeah.
and throw in all the others. Do the ashwagandha, the rhodiola, do all that stuff.
Yes.
And you may have to come back and tell us. We want to hear about it. So if it works, come back.
Yeah, we're gonna have to consider doing some couples redo after this, because how
that would be good.
Yeah.
No, and then we can tell them what I took, not beforehand though.
Not before,
Yes.
He's gonna be like, what happened?
Yes, where's my wife?
The take home is there is help. There are definitely viable solutions that will fit anyone's, whatever their profile of what their needs are. So that's
excellent. And I'm so happy, and I know a lot of women will be happy hearing this also.
Yeah.
So here on Menopause Diaries, Real Talk, Real Stories, we are strengthening marriages. There we go.
Yes.
We're strengthening women. We're strengthening marriages and relationships. Thank you so much, Darlene. We really, really appreciate it. And, you have just been a wonderful guest, and we look forward to seeing you next time.
All right. Thank you. Bye-bye, everybody.
Take care. Thank you.
Bye.
All right. Take care.
Bye.
This is
Menopause Diaries, real talk, real stories.
Thanks for listening. Let's thrive together through every
Hot flash.
mood swing and sleepless night. Don't forget to like, share, and subscribe to Menopause Diaries, Real Talk, Real Stories. If you have questions or want to share your story or would like to be a guest, visit us on Instagram at Menopause Diaries Podcast. Let us start a conversation and navigate this journey together.